Journey is the first value-based healthcare initiative realized simultaneously at international level in two centers of excellence, one in the UK, so at St. Mark's Hospital in London, and the second one in France, in Paris, at the Boujon Hospital for the treatment of the short bowel. The project saw the involvement of several key stakeholders, and among the others, your business partner is a consultancy company of excellence focused on strategy and innovation in the healthcare sector, Pint, the patient association, and Expert Mode, that led the development of the digital training platform for patient and healthcare professionals. The project was unconditionally sponsored by Takeda.
The Human Journey project was a very interesting project that we completed. The aim of the project, the Human Journey project, was really to try and understand the pathway for patients who have short bowel syndrome, a rare condition, with a view of enhancing the patient experience, to understand the problems that they have and improve operational efficiency for these patients. So this project was performed in 3 stages. The first stage was with patient interviews and home visits in order to really understand the patient experience. The second stage was with the clinicians and the teams who were involved in looking after the patients, comprising doctors, pharmacists, nurses and dietitians looking after the patient. So we all sat together, went through the pathways for these patients, and doing that in different centres is interesting to see different approaches that happen. And the third stage would be to get all the data from that together to try and look and develop solutions for where there were problems and maybe even unnecessary complexities that needed to be overcome. The 3 important outcomes that came from this project were to identify that patients really need to have better psychological support, and that it isn't always easily available, but it's something that we really do need to focus on to help patients cope with a chronic condition. Another element is about digital support. Digital support can make it easier for patients to be able to interact with their healthcare teams in different ways, out of hours, and also for the healthcare teams in the hospitals to be able to receive information, make arrangements. The third element related very much to trying to strengthen the local bond of care that is around a patient. And the reason for this is that specialist services are often not local to a patient. Patients have to travel quite a significant distance. And therefore, it's really important for the specialist services to enhance the knowledge of the primary care services, the doctors looking after the patient immediately when they see a patient, for the home care nurses and home care companies to have better information about that patient, and also even for the local hospital with the emergency room if the patient becomes acutely unwell, to have more information available for that patient. This whole element is really important to bring together for patients to have a better overall experience.
Boujon Hospital introduced Expert Modes, an innovative digital training platform designed for both patients and healthcare professionals. This platform provides comprehensive training sessions on the daily management of short bowel syndrome. Everyday topics are covered. Expert Mode has demonstrated its acceptance with more than 1,500 sessions performed during the last 3 years, and its efficacy in improving quality of life. The training program improves patient self-management and safety by offering interactive training with videos, PowerPoint games, and recommendations. This empowers patients with a better understanding of the disease and the treatment, including parenteral nutrition, medications, diet optimization, and the platform also learns to manage potential complications. Expert Modes help patients follow their treatments safely and with more confidence at home, and improve the acceptance of the disease. For healthcare professionals, the platform offers accessible, up-to-date guidelines, best practices, and certification sessions. This ensures consistent, high-quality training in intestinal failure, which in turn improves the quality of care. Inspired by Beaujon's initiative, St. Mark Hospital has decided to adopt the Expert Months training platform and is also developing a patient-focused website to help navigate benefits and administrative processes.